Hi, my name is Wadi Tala, a Famer Institute Global Faculty. I will try in this short presentation to highlight the steps of problem solving in PBL curricula in health professions and its relation to the taxonomy of educational objectives. As you can see in this slide, the cognitive domain in this taxonomy starts in its lowest level by recall of knowledge, then comprehension or understanding, application of knowledge, analysis, then synthesis, and by the end, evaluation. Then added in the updated classification, a new level, which is called creation. Please remember all these levels because we are going to link these levels to the steps of problem solving. At the beginning of the week, in what's called brainstorming session, the students confront a problem that's just above the level of their prior knowledge. It should be neither too difficult, otherwise it will inhibit the process of problem solving, nor too easy. Otherwise, it will not be recognized by the students as a problem to be solved in the first place. We build up the cases in a way that each scenario contains a well-balanced content from the basic clinical and behavioral sciences with a wider base of basic sciences in the early phases of the study and a wider base of clinical and behavioral sciences later in the curriculum. I would like first to show you how the class tutorial in PBL looks like, where the students gather around a table in a small class. They choose a different chair and rapporteur for every session. And the facilitator takes an eccentric position and plays a subtle role. So the steps of problem solving starts by reading the problem, then clarifying the difficult terms. So if we come back to the class here, as you can see, one of the students say, I have a dictionary. Another one says, I will search the net. And sometimes the facilitator or the tutor help the students clarify some difficult terms, because one of the jobs of the tutor is to help the students achieve their objectives, whether process objectives or content objectives. In the second step, which is called identification of the problem, which is a highly important skill for every physician. to be able to identify the primary problem of the patient. The students go through 3 important levels from the cognitive domain of the taxonomy of educational objectives. The first is to recall their prior knowledge and relevance to the problem. The students pose questions about things that they don't understand. And here comes the second level, the comprehension. And then the students try to apply such knowledge to be able to jump to the next very important step, which is the analysis step. Students tend usually to jump over the analysis step, and it is the duty of the tutor to watch the group dynamics and to help the students achieve their objectives. Then, in the 4th step, the students synthesize their assumptions and identify resources to restructure the problem. Usually, the synthesis of the problem is much difficult than the analysis of the problem. In the 5th step, the students formulate their learning objectives in a trial to fill gaps in their knowledge. So, in step number 6, students individually or in groups gather information from many available resources like the library, the internet, the simulation labs, clinical skills lab, audiovisual unit, structured lectures and seminars. They go outside for field visits, and they can even consult the subject area experts in their offices. As you can see here, in between the 2 sessions, the brainstorming session and the second session, which I'm going to tell you about in a minute, the students go for self and group learning between the 2 sessions and during the week. By the end of the week, the students reconvene in what's called the briefing session to share information, evaluate knowledge by critical appraisal, and solve the problem. Then do a formative evaluation for the whole session. And this will be the last step. So I leave you now with the 7 steps altogether. Thank you.